Yeah, this is a very interesting question, the diagnosis of MDS, because had we talked just a few years ago, the idea was that we are still based on bone marrow, which is the old traditional way. However, in these days, we are in a kind of transition. We are still based on bone marrow examination, looking at the morphology, counting blasts, as well as genetics and flow cytometry, which can help. However, there are several reports today that suggest that probably we may be able to diagnose MDS more accurately and more objectively. And this is based on genetics, and this is based on additional tools such as digital tools, and hopefully this may be able to be done by testing blood, peripheral blood only, without bone marrow. So still, if we are talking about the end of 2024 or 2025, which is coming, yes, we still do bone marrow to all patients that have to be diagnosed. But probably in the next few years, we will talk about additional new methodology, which might be able to skip bone marrow examination, at least in a certain percentage of our patients.